Hey, I wanted to ask a question. It's kind of off topic of what you guys are talking about today, but it's kind of a question about Medicare for All. If,
Sure, please, of course.
Entertain that. Yeah, so I'm obviously from the Midwest, and I live in an area where, there's a lot of conservative folks in Southern Illinois. And I was kind of wondering how in a person-to-person conversation do you think you can explain Medicare for All and the reasoning behind it and get across kind of, the reasoning also why it could be kind of like a public good for people?
Well, I would start with, I think the what has happened in this country is that it's been sort of like presented as if it was something that is like incredibly radical. And so I would start with the, making sure that whoever you're speaking with knows that, like, we have 45 to 60 million, really, 60 million people who are on Medicare already. We have another, 80 million that are on Medicaid. So we already have almost half of the country on a single payer healthcare system, but it only gets more efficient with the more people that you bring into the risk pool. And so that's where I would start.
And the people who are on Medicaid are in higher risk categories. So bringing in a larger population of people who are, younger, whatever the case may be, would have that effect.
Yeah. Right now we have, for the most part, between Medicare and Medicaid, theoretically, the most likely to, get ill and need it, older people and people living in lower income. And so it really is, and people love both those programs, frankly, people who are on them. And it would, the increase in efficiency would allow for more offerings. And as a society, right, if you don't contemplate, like, what are we paying in the private sector? What are we paying in the public sector? As a society, we would pay less for healthcare and get better outcomes. That's where I would start. And then I would just say, like, contemplate the idea of going to the doctor and not worrying about cost, and also not worrying that maybe your doctor is prescribing a medicine or a procedure or even an examination that is a function of what is most profitable for them, because that's actually the reality too. There was a great piece by Atul Gawande like 15 years ago now about two towns in Texas. And one was just, the rates were just much more expensive. And it would just so happen that the doctors owned, different medical equipment that, if I own my own hammer, then everything's a nail. And, even if it's subconscious, that's what that's what tends to happen. So I would say just not as radical as one would be led to believe in this country. We have, and that doesn't even include the VA, which of course is not just a single payer of healthcare. It's actually a government-run provider of healthcare. It's full-on socialized medicine as opposed to just insurance. That's where I'd start.
Okay, yeah. I generally start with folks, especially around here. I know what the people focus on. I try to start with the underlying reasoning as to why single-payer healthcare would be good on an individual level, because you don't have a choice to enter the market necessarily for oncology services, for instance. You kind of just need it. So I try to do that first, but I think maybe, what you say is probably a
I think presenting it that way is more complicated. I think people just want to not be afraid of it. And the reason why they shouldn't be afraid of it is because Medicare, who's not psyched about Medicare?
Yeah, nobody.
Right.
Well,
honestly,
maybe, not very many.
Yeah, it's certainly, you can say, like, ask your parents or ask your grandparents what they think about Medicare. Is there some difficulty? Which is better? Let's put it that way: private insurance or Medicare, right? It's a slam dunk, I think, and it's just like, why not for everybody? I appreciate the call. Folks, there's more of what you've just saw where that came from. That's if you hit the subscribe and like button. Thank you. Really, thank you.